I'm going to start, and I think you can start.
So, it's nice to see you, nice to meet you. My name is Manen. I'm a physician in newborn intensive care. I don't know, have we met before?
I took the class with Dr. Soles last fall semester, so I attended your lecture.
Right. In the videos that I circulated, she's in one of them.
Oh,
She's one of the stars.
do you have credits at the end with everyone's name?
No.
You have to figure out the ordering.
Yeah.
So your first name again?
Sir Jana.
Sir Jana.
Yes.
And yourself?
I'm Ryan.
Ryan.
Mm-hmm.
And I overheard you're in cardiac surgery, is that right?
Yeah.
And you're in subspecialty residency or
Mhm.
fellowship?
Yeah, in residency.
Okay, perfect. It's nice to meet you as well.
Speak to you.
So I brought a whole bunch of slides with me. Even after all these years, I still find it a little jarring being on camera. So, forgive me for any of that. But I'm hoping that our talk today is not just me going through slides, but rather us having a chance to talk together about the topic. Because ultimately, I think you get more from a session on ethics if you're engaged in discussion around it, compared to if, again, I'm just doing something didactic. We've typically done the ethics sessions over 2 sessions, and often we've had a weekend in between or a week in between. This time we're going to have a bit more time in between. So you see me today, and then you'll be seeing me again at the end of the first week of October. And I'm hoping that what we can do is essentially a conversational assignment in between. So I'm going to open with it just to give you an idea about it. Oh, look at this, I have the date wrong. I'll change the date. Essentially what I'm hoping that we can do is have each of you choose a particular technology, whether it's used in a health context or not, and prepare really a short presentation about that technology. I don't want you to spend hours on this by any stretch. It's not for marks, there's no grade associated with it. But I do think, and Kim agrees with me, or correct me if I'm wrong, Kim, this does make for a more interesting, supportive discussion session. If people have the opportunity to present the technology and then to have some conversation about it. And these are the kind of questions I want you to think about when it comes to the technology. I'll send you a copy of the slides after, so you have these in front of you as well. You certainly don't have to answer all of these questions. These are just possible starting points for introducing that technology and having some discussion around it. In the past, we've had people choose clinical technologies like AI scripts, AI scribes, for example. We've had people choose things like ChatGPT. We've had people choose more traditional old-fashioned technologies as well, and also hypothetical ones or speculative technologies. So have fun with this, if that makes sense. Does that sound okay? I'll send this link as well. So in addition to being a physician in newborn intensive care, I'm responsible as the director of the John Doster Health Ethics Center. We organize seminars throughout the year. We had a seminar today on organ donation and ethics. And our sessions typically are every 2 weeks on Thursdays from noon until 1. Please feel free to visit the website, to subscribe to the website. And that way, if you see a session you want to join, you can at your leisure. Okay. We also have other offerings throughout the year. We're supporting a film series called Death Matters. And the next film that's going to be screened will be at Garneau Theatre. I believe it's on Wednesday next week, September 24th. Free admission, grab some free popcorn, enjoy the show as we talk about death and ethics. So, what is ethics? How do you understand the meaning of ethics? What do you see as significant ethical questions for medicine, whether it's your practice now or how you imagine your practice to be in the coming years. How do the ethics of technology relate to the ethics of medicine? At what point do these overlap compared to being the same things? When you think about ethics, what qualities exemplify being an ethical physician, nurse, or other practitioner, or even a designer of health technologies? How is ethics embodied within the technology compared to embodied within its use? What is the role of ethics in clinical practice? So to start off with, how do you see ethics?
It's usually like a discussion or some sort of debate around actions, behaviors, good and bad, but it kind of depends on the context. So you can have some conversations about objective good and bad, you can have others about decision making and settings like medicine.
So I think that's a really nice way of starting it. There's a normative dimension to ethics, right? Meaning usually when we start talking about ethics, very quickly people start to say it's about something that matters, right? Something that matters not just in the sense of it causes something, actions, right? But it matters in the sense of maybe it's good, maybe it's bad, maybe it sits right with me, maybe it doesn't sit right with me. Right? Any other thoughts?
I would say that when I think of ethics, I think of principles that guide us to treat others as fairly as possible.
So when we think of ethics, we often think of appealing to something else, right? So, you know what, if I walked in the room today, and I'm walking in the room, Kim were to say, hey Michael, how are you? And if I completely ignored him, right? That would probably not sit right with him. And he might reflect on, and he could reflect on, well, why doesn't it seem right to me? And maybe he could reflect on it as, I was being friendly, right? How can someone not respond to someone who's being friendly when you have a history with each other, when you know something? So you appeal to something else. Sometimes we appeal to principles, but sometimes we appeal to other kind of things as well. What I would say typifies health ethics, and particularly ethics in medicine, is that it's not just about what sits right with me as a doctor or as a nurse or any other healthcare provider. In medicine, we're ultimately responsible for caring for someone other than ourselves. So many people will say that health ethics is not necessarily about realizing what's good for me. It's about orienting towards our patient and their families to try and support decision-making and actions that resonate with their values. And that's why we talk about health ethics often being a professional ethics. So I'll give you some concrete examples. And these are little vignettes from the NICU. A premature baby lays in an isolette. A sheet cast over the housing mutes ambient light, just as the plastic structure itself attenuates sound. Only traces of the outside world seem to be allowed in. Within, rolled towels support the baby's body in a position of flexion. His arms, trunk, and legs shift in subtle shudders before settling in stillness. The eyes gaze, yet seem to lack a point of fixation. What is life like for this child? What experiences of sight, touch, and smell exist for him? So I would suggest that these are fundamental ethical questions for the practice of newborn intensive care. Because in newborn intensive care, we're taking care of these little babies. Babies who can't tell us what matters most to them. A baby is by nature pre-verbal, right, in a sense. And yet, we're hoping that our care is not just treating them as someone's child, but it's treating them as someone who is going to one day be an adult, going to be again a child, right? A person in their own right, if that makes sense. But of course, it's challenging because we're still getting to know this little one. Right? So these are questions of ethics. In an adjacent spot, a newborn is sedated and paralyzed as we struggle to maintain oxygenation. The baby lays splayed with only the chest moving, vibrating in response to the airflow of the oscillation machine. As we're talking, the baby's heart rate rises. With muscles relaxed, she cannot move, let alone open her eyes. Does she experience isolation or loneliness, pain or discomfort? What words are appropriate to describe her existence? These are also questions of ethics. How do you approach the life of someone else who cannot give voice or words to their own experiences? When we start to label a baby as being in pain or being agitated, suffering, experiencing delirium, many of us have our own sense of what these words mean, but do they aptly describe what this life is like for this baby? If we don't respond to them, that would be unethical, you could say, right? If we don't kind of regard this other person, right, as having a perspective of the world, that would be challenging for ethics. Yet at the same time, there's also an ethical tension in beginning to give language to what their world is like, knowing that they are not the ones who choose those worlds. Tucked in at the end of the row, a baby sings almost too well to be in intensive care. The nurse brings a soother towards his mouth. He puckers his lower lip and rolls his tongue, stroking the soother against the corner of his mouth. The nurse pauses for a brief moment. His eyes are fixed firmly on her. Taking the soothe in, he gives it a few short sucks before letting it fall off to the side. How does a baby experience a world of others? How does he experience a world of things? So I'm drawing these vignettes from the practice of newborn intensive care because that's the concrete environment that I work in. And part of the reason I love working in intensive care, newborn intensive care, is not just because I enjoy doing procedures, I enjoy, making a clinical change and seeing a response right away, right? I don't have the patience for family medicine and prescribing someone a pill for their cholesterol and checking it, weeks later and saying, yay, it's a bit better. No, I like, right? So we all choose a practice that fits with our personality. And for me, newborn intensive care it's fascinating because we're dealing with these children. And at the same time, we're also dealing with their parents who are absent from the spectrum. And most commonly, we get along with parents, and parents help us realize what's so-called the best decision for their particular child, recognizing that we're making the decision for their child rather than so-called for their parents. And neonatology, of course, shares a lot with other areas of pediatrics. As children are so-called developing autonomy, developing the capacity for language to express what matters most to them, both in that particular moment as well as in the future. But what's also fascinating about neonatology or pediatrics is if we think of the practice of medicine, medicine is fundamentally about technology. Everything we do involves technology, whether we're talking about what we use for diagnosis, or what we use for prognosis, or what we use for treatment. And what's pictured here are different technologies, all of which affect children's lives in very different ways. So coming back to the question, what is ethics? We can say ethics is founded in the concern For whom or what is other to ourselves? I've used this example over and over again, right? Everyday world example. If you open the fridge and you know what, there's some leftovers in it, right? And they're really good leftovers, right? Maybe you ordered some great like food last night and they're just perfect, right? And you go and open the container and you realize, you know what, there's only one portion here. Right? It's not really an ethical question if you just think, should I eat it or not? Right? But it becomes an ethical question if we start to say, well, if I eat it, then my wife can't have it, or my kids can't have it, right? Because now my decision is affecting someone other than me. So ethics, you could say, becomes a concern the moment this other is introduced. Both in the sense of trying to approach what their role is like, but also just recognizing that they call upon us from the perspective of an ethical impact. We can also say that ethics is beyond logic. In other words, it's not a discipline that can just be addressed by reasoning. Right? So if you think about the kind of statements that we make in day-to-day life, right? Some are a priori true, right? For example, if I were to say a tricycle has 3 wheels, that's true by definition. Right? 1 + 1 is 2. It's true by definition. Right? There are other statements that we make, and we have to verify them after the fact. Right? You know what? There's a hint of smoke in the air outside, and you know what? We can go outside together, and we can smell it, and we can say, do you agree or not? Or you know what? It's starting to feel like fall. We can go outside together and kind of say, do we agree? Right? It's not true first and foremost. It's only true after we verify it. But the question is, when we start talking about ethics, what kind of statements are those? When we say, you know, so-and-so is a good physician, right? It's not by definition true, and we can't necessarily just verify it after the fact, but rather, as you said, it appeals towards something else. It deals with normative questions. Normative meaning what is good, what is bad. And ultimately, these questions, in some way, they resonate with us. And they may resonate with us because we were brought up in a particular way. We were part of a certain culture or a certain religion. Right? You know, what was right 10 years ago in certain parts of the States might not be right today. Right? Ethics get redefined. It used to be very abnormal, right, to see like prominent late night hosts getting fired, right? But now it's something that seems okay. Right? It used to be very abnormal that a president could say something which isn't true. Now it seems to be something that is okay. It used to be that, you know, people had some kind of autonomy over their body in the States when it came to reproductive decision making, regardless where they lived. Now that's not necessarily true. So this is what we say, that ethics is also something that it's not just in the past, it's not just in the present, it's constantly something evolving. So how do we stand intersections between ethics and technology? So we can begin by saying that technologies are everywhere around us. What it means to be human is to be technological. And there are many contemporary philosophers of technology who essentially have said, you know, to be human is to be technological. In fact, our capacity to embody technology is what makes us uniquely human, what makes us uniquely who we are. Just think about this room that we're in right now. It has shaped our relations with one another by different technologies. here I am having these slides that I prepared in advance. That kind of sets the piece, the structure for what we're going to talk about. The fact that I'm projecting these slides behind me, it means you're not necessarily just focused on what I'm saying, but also what I'm showing. It creates a certain kind of power dynamic in me, right? Here I am, I have the screen, so I kind of have the floor. There's this camera on me right now. This lecture doesn't just stay in the room, right? It goes onto YouTube, right? And exists there, I don't know for how long. So maybe it introduces a sense of accountability. There's the technologies that we're all wearing right now. 3 of us wearing glasses. Some of us are wearing jewelry. Some of us might be taking medications. We're wearing clothing. All of these affect our embodied way of being in the world. The way the classroom is structured. How is it we all chose one side of a square, right? Like, very nicely set up. But it makes it more of a conversational space than if we were sitting in rows, or if we were joining by Zoom. So I'm merely meaning to say that we encounter technologies in an everyday way. So much so we don't generally think of them. Meaning, when you walked in the room today, I'm betting, I could be wrong, but I'm betting that you were not saying, I wonder how my conscious existence, how my experience of this session is going to be influenced by the video camera, by Michael using PowerPoint, by the lighting in the room, by the furniture, or any of these other technologies. So when we think about the connection of ethics and technology, ethics shape how we encounter others in the world and what we do in our treatment. Now there's a branch of technology studies referred to as post-phenomenology, coined by Don Ivey, a philosopher from the States, who basically said that, look, when we're thinking about technologies, we need to take a critical stance, and we need to realize that technologies are all very different in how we interact with them and how they disclose the world. So there's some technologies that we embody. When I put on my glasses, right, I feel normal. I embody them so deeply, I actually feel abnormal without them on. If for some reason my wife plays a trick on me, because she's that kind of person, this is on YouTube, I can say that, and she decides to take my glasses and move them somewhere else in the morning, which she sometimes does, right? I'm completely disoriented in my way of the world. When I embody a car and use it as a tool, my relationship to the world changes as well. I suddenly experience 1 kilometer very different than I would if I was running. Right? So this is what we talk about when we say embodiment as a village. When I pick up a hammer, my hand itself becomes an object of hit, if I'm fully embodying that technology. There are those that we have a hermeneutic relationship with. It's not simply that we embody them, but they change the way in which the world is present. A good example of this would be something like a thermometer, right? Or any other device that so-called tells us the weather. Right? It makes the world present in a particular way. There are those technologies that I experience as an other to me. Hey Siri, set a timer for 3:20. There's an otherness there.
52 minutes and 35 seconds, starting now.
If I get frustrated at my computer, this stupid thing, right? It's a different way of encountering a technology than embodying it or hermeneutic. And then there's others that are in the background. So ID kind of points to these 4 different ways of embodying technology, or better to say, technologies mediating the world. But then people who've come after him have pointed to other ways, or they pointed towards the fact that some technologies we both embody, but we also encounter them as an alterity. So coming to that beginning exercise, we could say one way of approaching any technology is to ask, how is it that this technology makes the world present? Right? So coming back to the environment or the context of medicine, thinking about intensive care. When we pick up a stethoscope and we go to listen to a baby's heart, it actually changes our relationship with that baby in a very particular way. Or think about picking up a stethoscope and examining someone who's older. Right? In many ways, you can say that a stethoscope silences our patient. Right? If you're going to listen to someone's heartbeat, you're going to say, shh, don't talk. Right? And I would suggest that when you encounter someone else with a stethoscope, you're no longer encountering them necessarily as a person per se. You're encountering them as a heart to be heard. Suddenly you're listening to S1 and S2. Is S2 split normally? Is there a rub? You know, all of those things that cardiologists listen to. It changes the relation. So if we embody stethoscopes, we can say that things like X-rays or imaging technologies, we have a hermeneutic relationship. So they show us a child in a particular way. This is a picture of a baby with diaphragmatic hernia. Right? So again, we cease even thinking or seeing this as a boy or a girl, or necessarily even someone with a name. Right? We're looking at what's normal, what's abnormal. We routinely take care of babies in isolate. Why? It keeps them warm. It allows us to do things like give them phototherapy for jaundice. If they're really small, it allows us to regulate their humidity for their skin. And in that way, in many ways, we use technologies like isolates. But we also have to remember that we encounter isolates when we're trying to take care of a baby. So if I want to hold a baby who's crying, who's in an isolate, I have to reach in to touch them. Right? It forces me to contact them in a particular way. And if it's restricting my ability to soothe them, I might encounter it as an other. And then there are, of course, those technologies in the background. But just because the technology's in the background doesn't mean it doesn't, again, shape our relationship to others. So take the monitor screens that we use in the hospital. If you see a parent who's had a baby born preterm, say at 26 weeks gestation, and their baby's been in hospital for a month, the monitors, they're kind of there for the nurses and the doctors, right, to support the medical care of the baby. But I guarantee you, the parents have learned to read the monitors, right? And when the monitor goes off, they tend to look at the monitor, often more than their own child. Right? If the baby's crying, they'll look to the monitor. It becomes one way of knowing their child. So we have to attend to that, if that makes sense. So I introduced that merely by saying, or wanting to begin to say, that our everyday healthcare experiences are mediated by technologies. And if we understand healthcare as ultimately oriented towards patients and their families, as an ethical engagement or an ethical endeavor, technologies are going to shape the way that we encounter others in our world. So you could begin by saying that ethics and healthcare or medicine are intimately linked. So how do we begin to unpack? Sorry, I was on a call last night, so it was one of those nights. Unpack what makes a technology ethical. And you were saying earlier that what we often do is appeal towards something else. So there's many different approaches to ethics that kind of locate in a reasoning way what is so-called good or what is bad, meaning how we evaluate something and how we might evaluate a technology. And it's really important in medicine to kind of, I would say, have this vocabulary so when you're in situations where you're not sure how to act, you can begin to unpack that situation. Or if you're in a situation where you disagree with your colleague about what's the right thing to do, you can start to understand how they're making sense of that situation. And for those who are ultimately designing or using technologies, which I said is inherent to the practice of medicine, we wouldn't have medicine without something that we could do without technologies. Right? It's also important to be able to take a step back and ultimately ask the question of, in what way is this technology supporting me to address what matters most, what's good? So the first way of looking at something from a moral perspective would be called taking a deontological perspective, which refers to obligation, duty, or rule-based ethics. And I think, medical school does a really good job of teaching deontology. It does a really good job of examining residents on deontology. So most of the time, people who are at some stage in the residency, they appreciate that when people are talking about health ethics, they're probably talking about things like beneficence, non-maleficence, autonomy, and justice. And these are the so-called principles, which means that if we're trying to figure out whether something is right or wrong, or good or bad, we can judge that action based on how it appeals to a certain principle. So those are the so-called principles of medicine. But there's also principles in other formulations of morality. So the 10 Commandments is an example of 10 principles, 10 obligations. If you want to know whether you're doing the right thing or not, look at the commandments, or the sayings, for example. The question is always, how do you decide which principles are the ones you should follow? And this is where the philosopher Immanuel Kant came along with the idea of the categorical imperative, which essentially boils down to act only according to the maxim whereby you can, at the same time will that it should become universal law. In other words, a good principle to follow is one that you would want others to follow if the situation were reversed. So if one of the principles that we say is thou shalt not kill, then that will be something I would expect others to do in addition to myself. If it's something I'd only want other people to do, but not me, then it's probably not a great principle. But this still means at some point, there really isn't a base to principles, aside from we've made an agreement together to say that this is something that we should follow. Does that make sense? And we know over time, certain prescriptions or obligations that were there in the past are no longer considered right in contemporary society. So we've seen that shift. The other thing that we have to acknowledge in principles is they're inherently abstract. Right? So to give an example, when we talk about respecting the autonomy of someone, usually people say that means respecting their independence. But what does respecting the autonomy of a baby mean who can't voice or give words to what's going on in their life, compared to respecting the autonomy of someone who could write a thesis on what their values and their perspectives are? How is that different? Right? What if you have someone who's a substitute decision maker deciding on behalf of someone else? How does that feature into autonomy? So principles are inherently abstract, and they get specified or made more specific in a particular situation. Are there any questions you have about this? So for technologies, we can think about, all right, if I'm talking about a good iPhone, what principles should inform its design? When we talk about AI and large language models, what principles should inform its design? And it's funny, often when you see people writing about the ethics of something, the principle papers are the first to appear. So there's now tons of literature on AI and ethics which talks about these are the principles that should inform AI design. Right? It should be transparent. Right? We should have an understanding of how it's coming up with the words, the phrases, the text that it's generating when we're talking about large language models. Right? It should be free of biases. Right? Another way of looking at whether something's right or wrong is to take a consequentialist perspective. So here the rightness or wrongness of an action is judged based not on some abstract principle, but rather what end is ultimately achieved. And generally we have to agree, what end are we trying to achieve? So are we trying to achieve the end of, save the most lives possible, like during the COVID pandemic, and that's how we decided to allocate vaccines, right? Are we trying to save the most jobs possible? Are we trying to prevent any one person from dying? Are we trying to make the most people happy? Right? Consequentialism ultimately judges, the ethics of a situation based on how well we achieve that utility. But we still are stuck with that situation of trying to decide what is it that we're trying to achieve. In medicine, we often use consequentialist perspectives when we draw on the principles of beneficence and non-maleficence, right? Doing good and not doing harm, where we think about there being some way. We use it in pediatrics when we refer to notions like the best interests of the child, right? Orienting towards interests, which is actually something quite broad. It doesn't just mean medical interests, it means things like welfare, development, and other aspects. So we can think about technologies as what ends are they achieving, right? So if a particular technology is being used to prevent medical errors, and that's ultimately what's a good thing, right? Then the fact that we might have some new AI-based technology that's going to put out of work a whole bunch of radiologists, maybe that doesn't matter, because what we're trying to do is prevent medical errors. And if the tool does a better job at interpreting x-rays than people, from a consequentialist perspective, it's doing a good thing. Does that make sense? Okay. And I'm not saying that all radiologists are going to be replaced by technologies. It's being recorded, really. It's hard. There's also character-based perspectives to ethics. All right. So here, instead of asking the question about what end are we trying to achieve, or what principle are we trying to abide by, it's rather shifting to ask what are the qualities of this person who is acting, and how are they exemplifying those qualities in their actions. Right? So maybe we all agree that what makes a really good doctor is someone who is compassionate, right? Or someone who's empathetic. Right? And how we realize that is by saying, well, are they acting empathetic in that particular situation? Right? So their actions are going to fulfill that character, if that makes sense. Again, we're in that sticky situation of having to say, how do we decide what virtues we ought to aspire to? Right? That can be defined and changed over time. Right? But we are orienting ourselves in a different way to a situation than either principlism or consequentialism does. Right? So, a couple years ago we were talking about AI and empathy, for example. If an AI technology supports a doctor to be more empathetic, that is so, it's fulfilling the character-based ethics approach, right? It's helping from their virtues perspective. I think we were also talking about could AI in itself be empathetic. We can talk about that if someone chooses one of those technologies. There's also communitarian perspectives to ethics. Okay, so communitarian derives from to make common or share. Right? And the easiest kind of example of a communitarian perspective to ethics I like to take is a narrative approach to ethics. So if you think of it, a lot of people make sense of a situation through stories. And sometimes, you know, if you're having a hard time explaining something to someone, you might give them an example. Well, can I tell you an example when something like this happened? And a question comes from an ethics perspective: what makes a good story? And I don't mean a good story in the sense of an entertaining story, right? One that kept me riveted, one that I wanted to see the end of. But what makes some stories good in the sense of we feel comfortable sharing them, and others we feel, you know what, I don't think I can talk to someone else about that. So the situation where there is, you know, a code in an operating room, right? And, you know, someone passes away, right? Some of those situations unfold in such a way that, you know what, we can share what happened. We did the best we could considering the situation. And it's not that we just abided by certain principles. It's not necessarily what the end was, nor is it necessarily all of the, you know, character qualities of everyone who acted in that story. But it's how everything holds together. And that's a communitarian perspective to ethics. The rightness or wrongness of something is how everything holds together. For narrative ethics, it's the narrative. For relational ethics, it's the relation. And I put ethics of care here, which is a point to feminist theories of ethics, which again, I think fits better in here than perhaps in some of the other areas, but also kind of deserves its own discussion, which we won't have too much time for. So we can think about how do technologies support our relations? How do they support our storied existence? Right? Or otherwise bring us to death? There's also contractualist perspectives to ethics. Here the idea is that what is good or what is bad isn't something that's out there in abstract principles. It's not in the ends that are achieved. It's not in how everything holds together. It's not in particular virtues of people acting. It's rather in the agreements that we form with one another. Right? So in a way, each kind of set of actions starts with a blank slate. And then together we might talk. We might say, you know what, let's make an agreement. Right? So maybe I'm a surgeon and I say, look, I'd like your permission to do this heart surgery on you, coronary bypass or whatever. Right? And you talk to them about the risks, the benefits, you get their informed consent, right? What you've done through that conversation is formed a contract, right? An agreement of what you're going to do. And to be a good surgeon in that situation is to abide by that contract. So if you take the person to the OR and you say, oh, you know, I don't feel like doing this today, I'm going to take out their appendix instead. I know you don't do that, right? Clearly. But, you know, the idea is that, you know, how we should act is based upon how we come together and form an agreement with one another, which is different from those other perspectives. And last are, we could say, casuistry or pragmatic perspectives. Right? So these are those perspectives whereby ethics is, we kind of look at it in the setting of previous cases or previous decisions or previous events, and we judge how we're acting now with a reflective eye to the past to learn from it. So an area that we see a lot of casuistry would be in the legal system, in case law, right? whereby, you know, here you have two people arguing the ins and outs of a particular case, and ultimately what they do is they appeal to previous judgments, previous cases. Right? In this previous case, right, it was judged as being right because of this. How is that case different from the current case? So for example, in neonatology and newborn intensive care, there's been a long time struggle around the question of how much intensive care or invasive medical or surgical treatments should you undertake for children with life-limiting conditions, like trisomy 18, for example. Right? And often what we do is when we have a baby who's born with trisomy 18 and the parents want them to undergo a complex surgery like a Norwood procedure for hypoplastic left heart, right? We'll say, well, what did we do the last time, right, when we had this situation? Well, last time we did do the surgery. How did that turn out? Right? What did we use to kind of make a judgment about the appropriateness of doing that surgery? So it's not that the past defines the present, because I already told you it would be really problematic if you merely said something is ethical or not based on the past. Because there's lots of things that have been happened in the past that we look back and we say, how is it that people ever acted in this way towards each other? But it's rather that we look at the past within the current context, right? And we try and learn from those past situations. And then you could say it's a Kazakh genocide. So these different perspectives on morality, there's clearly more to them than I can get into in about 10 minutes, but this is kind of ethics 101 for the purpose of this class, right? To start to recognize, all right, when I'm making a judgment that this is right, how am I coming to that judgment, right? Maybe I'm drawing on principles, maybe I'm looking at it from a consequentialist perspective and so forth. So I'm trying to help give you that vocabulary, or maybe point to some different ways of thinking. And all of us have our own tendencies where we tend to draw on some of these perspectives more than others, and also particular situations that demand particular perspectives. Right? Like consent conversations very much draw on contractualist perspectives of ethics, if that makes sense. Any questions you guys have about these? So to okay. So there are many different perspectives about technologies, and one perspective of technology that those of us, you could say, in the ethics community are trying to move people away from is an instrumental view of technologies, where technologies are viewed purely as neutral things. Right? So what do I mean by an instrumental perspective of technology? The sentiment, people kill people, guns don't kill people, right? That is an instrumental perspective of technology, which means that the technologies that we use, they are merely tools. Right? We pick them up, we put them down, but ultimately, our actions are our own, and they don't reflect in any way the technologies. The reason I say that we're trying to move away from that way of thinking is we embody technologies. So it's not that we simply use technologies, but technologies also use us. Right? They change this way of relating to one another. So that doesn't mean we shouldn't be responsible for our actions, but it does mean that we need to ask this question of how is a particular technology affecting our way of being in the world with others. Right? In other words, we can design with a view towards morality, or we could potentially ignore that. And this is the classic example from the technology literature, Langdon-Winner's bridge. So these bridges are common along the parkways in the United States. And you heard last time we did this talk, I used the same example. These are relatively low bridges, right? Which means that if you're a cardiac surgeon and you're driving around in a Mercedes, what do cardiac surgeons drive nowadays?
Few of them drive Mercedes. Right?
Yeah, Audis, yeah. Thought so. You're gonna have no problem driving really fast under one of these bridges. But let's say you're not privileged and working as a heart surgeon, right? And maybe your income is something that drives your social assistance. And, you know, if you wanna get under this bridge, if you wanna drive on this road, you're gonna have to take the bus because you can't afford your own car. Well, what would it mean if this bridge didn't allow buses under it? And that's the question that's really asked by Langdon Winder. Because the story is that many of these bridges were designed by Robert Moses, and they were designed with a particular intention. They were designed to be low, to essentially prevent people using public transportation from driving underneath them. And so these bridges were erected on a number of these parkways that would lead to certain public areas, like the beaches. And essentially what you're doing is you're using the bridges to keep a certain class of people out. So the thought is that there is morality built into this bridge, because it's built with a certain effect in mind, one that changes how we're relating to others. Now, whether that's actually true or not, honestly, it doesn't really matter at this point, because it's an example to try and illustrate this idea of designing morality. One philosophy of technology that's really helpful, I think, is actor network theory, which is the work of Bruno Latour. And essentially, he views humans and technologies as enmeshed. Not necessarily in that Don Idean way of mediational embodiment, but rather that, you know, how everything works in the world is a consequence of humans interacting with other humans, and humans interacting with other technologies, and technologies interacting with other technologies. And it actually gets very complicated, where all of these interactions essentially lead to these networks, right? And we can study these networks and the different relations between them. And in his writing, and in others who are kind of after network theory or ANT folk, they talk about things like delegation, translation, composition, reverse blackboxing, these different ways of how technologies figure into these programs. And one of his classic examples, again, just to give you a taste of this, right, is the sleeping policemen, right, which are, of course, the speed bump. Right? And Bruno Latour would say, essentially what we've done here is we've taken the role of the policeman who stands on the side of the road and make sure that people don't speed, and we've delegated that activity to this speed bump, right? Such that now the speed bump is carrying out this action of slow down, if that makes sense. So slow down, there's sleeping policemen ahead. Now, many of us would agree that this is a good thing, right? Particularly if we put these speed bumps around schools, areas where children are playing. Right? So again, we can say there's a morality to these programs. Right? On the other hand, it doesn't necessarily feel like a good thing if you break your undercarriage of your Mercedes-Benz because you're driving really fast, right? So, but my point here is just to point to another way of thinking about morality related to technologies. So what this means is taking a critical eye to technologies. and always asking the question of, well, what kind of program is this leading to, and how does that sit right with me? And this picture is from like some time ago. I used to have one from some COVID benches as well, right? But I still like this picture. I was just in Denmark and they had a really cool bench. I should have taken a picture. Sorry, mental note, that's here. What do these benches all have in common? How they're different? Well, they're all for sitting on, right? That's in common, right? Some of them have armrests. Yeah, that's the bench from Tokyo and the one from New York, right? Gosh, that one from New York looks a little dirty. It must be something about New York. Right? There's something different about the Edmonton bench, right? Like that one in Montreal, that's kind of cool looking, right? It has a neat aesthetic. But what's different about the one from Edmonton compared to the other ones is you can lie down on it, right? Now, what does this mean? It means that this bench is being designed for a particular style of use. It's being designed to support someone to sit down, to enjoy maybe a park in a particular way, or to wait for a subway in a particular way. But what it's not designed for is for someone to sleep on. So someone who doesn't have a bed, someone who doesn't necessarily have a home, right, or better say a house, these benches are not invitational. In fact, they're quite the opposite. Right? So they're designed for the public. Well, who's part of the public? Well, the public are the people who can use a bench for sitting on rather than for laying. That reflects a particular morality. Any questions about this? Is this intuitive? So the challenge for ethics and why it exists as a discipline, why is it kind of interesting, is because we're dealing with situations all the time in medicine, in healthcare, frankly, we have to act, right? The reason I'm a little tired today is because I was working last night, and it was one of those nights where I actually had to do stuff, right? I had to act, right? You can't just sit back and say, all right, should I or should I not, increase this medication or take someone to surgery? At some point you have to make a decision, right? But the challenge is, in medicine, often our decisions, there's more than one possible course of action, right? I could put a peritoneal drain in for this kid who has necrotizing enterocolitis, or I could take them for a laparotomy, right? There's two different surgical options there. And often we can appeal to evidence, meaning, for a patient of this weight, this clinical stability, what would the literature say is going to give them the best chance? But ultimately, ethics helps to figure out what are we aiming towards, right? So if a particular medical intervention gives someone the best chance of surviving, but the highest risk of disability, is that what we should take? Or one that privileges the opposite? So it helps us kind of work out what matters most. Recognizing that the practice of medicine isn't just about me as a doctor or you as a surgeon, right? It's about our patients. We often appeal to kind of common standards, right? Because at some point it can't be arbitrary, right? In that sense of, one patient is afforded one option, another is not, right? So something that we have for medicine is the Canadian Medical Association Code of Ethics and Professionalism. And for Alberta, this is actually, this codification of ethics is actually codified into law. So the Health Professions Act basically says that, look, you are legally obligated as a physician to act according to the CME Code of Ethics. Otherwise, you can be sanctioned by the college, lose your license and so forth, right? So it is a source of health law in Alberta. Different provinces are different. But we still have to navigate these decisions and these situations because these codes still end up being somewhat vague. Okay. So, coming back to this exercise, which again, I have the date from last year that shows I took this slide from last year. Any questions you have about that? Because this is ultimately what we're going to ask you to think about and prepare for October 7th.
I have a question. So, when we're considering the relationship we have with the technology, you mentioned that one pitfall of an instrumental new can be maybe it removes the autonomy that we feel for how we use it. With the other types of relationships, where we embody the technology or it's part of our environment, are there other similar pitfalls or kind of consequences that we should be on the lookout for?
Yeah, so I mean, I think, any way of kind of thinking about technologies is going to have benefits and drawbacks, of course. So one of the concerns is if you start so-called distributing responsibility or agency technologies, that makes us as people not responsible for our actions. Right? So if you were to say that, you know what, ultimately, these people who design guns, right, they're at fault for all of these school shootings. Right? Really what they did is they made those guns way too easy to fire. Right? So we're going to sue all the gun makers. Right? It's not the fault of anyone else. Right? So, a perspective that would put kind of all of morality on the technology, I think it would be also oversimplifying the situation, right? I mean, gun violence as an example, right, in the United States and unfortunately elsewhere in the world, isn't just because of the availability of guns, right? There's more going on there. That doesn't mean that the availability of guns isn't a feature of it, right? But there are also other forms of violence that we see in schools as well. So I would just suggest that part of the reason I think people are trying to move away from an instrumental perspective of technology is that it oversimplifies the situation and there's more complexity and nuance to it, if that makes sense. Other thoughts, questions? Well, Kim, that's all I got.
Okay. No, well, that's a great session, and I think the world is becoming a world in which ethics is more important every day than it was the preceding day. So, yeah. So this, you could argue is most important, most memorable part of the course. So.
And again, thank you guys for coming, and it's nice to have this session early as well in the course, because that hopefully means as you're attending the other sessions on whether it be AI or other aspects, trying to take some of these lenses to that material and ask some of these questions, right? Because we're constantly dealing with this, as Kim was saying, and it's amazing at the pace things are moving right now in so many different dimensions. It's hard to keep up, actually. All right.
Great.
Have a wonderful day.
Thank you very much, and we'll